This is Dr. William Huang. I want to thank you today for reviewing this presentation on prostate biopsy. If you're viewing this video today, then you may have been diagnosed with an elevated PSA and may be contemplating a prostate biopsy, or you may have been scheduled for a prostate biopsy in the near future. During this brief presentation, we're going to review the anatomy of the prostate and to discuss how prostate biopsies are performed. So let's begin by discussing the anatomy of the prostate. In this slide, you can see that the prostate is located in the pelvis and is fixed between the bladder as well as the urethra, which is the tube that runs through the prostate. In addition, the prostate sits on top of the rectum, which allows easy access for both manipulation and examination of the prostate, and also provides access to the prostate for prostate biopsies. During a prostate biopsy, the ultrasound probe is inserted into the rectum to allow for visualization of the prostate. You can see here in this cartoon representation, the transrectal ultrasound probe is inserted, allowing for visualization of the prostate. The images you can see here on the right side of the slide. A needle gun is then placed through the probe in order to obtain samples of the prostate. In this cartoon representation, or this map, you can see that the prostate is divided into quadrants, and then samples are obtained from each quadrant. The most common template in which we obtain prostate biopsy samples is a 12-core prostate template. In this particular template, the prostate is split in half, and then split into thirds between the base, the mid, and the apex of the prostate. Within each lobe, 6 cores are obtained, 2 from the base, 2 from the mid region, and 2 from the apex. You can see here on the right of this slide that the transrectal probe can be used to insert the needle and obtain a transrectal sample. However, the probe can also be inserted through the perineum into the prostate to obtain tissue samples that way. This is an example of what is seen under the microscope following a prostate biopsy. Each of the cores are then sent to pathology for examination. In this particular slide, you can see the individual prostate cores, which contain prostate glands. One of the cores here in this slide demonstrates a focus of prostate cancer. Now, some of you may have had a prostate MRI prior to the biopsy. The prostate MRI has the ability to identify lesions in the prostate which may be suspicious for prostate cancer, and therefore can be very useful in determining the need for a prostate biopsy, but also providing guidance during a prostate biopsy. Since prostate biopsies cannot be performed on an MRI scanner, the MRI images are imported and therefore overlapped with the live ultrasound images to allow us to perform what's called a targeted prostate biopsy, or a fusion prostate biopsy, which fuses the MRI images onto the live ultrasound images. On the right side of your slide, you can see here one of the platforms that are used to perform an MRI ultrasound fusion prostate biopsy. So as mentioned, you can see here the MRI images, which were obtained during the prostate MRI, are overlapped with the live ultrasound images, providing us with the ability to perform a fusion prostate biopsy. This allows us to identify certain areas of the prostate which may contain prostate cancer but cannot be visualized on a transrectal ultrasound. You can see in this slide that the fusion platform allows us to identify the location of the prostate biopsy cores on a specific individualized prostate gland. In this particular cartoon, the 12 cores from the systematic or template biopsy are noted. In addition, there are 2 areas of the prostate which demonstrated potentially cancerous lesions noted on the prostate MRI, which are then overlapped with the ultrasound images to allow us to perform not only the systematic 12-core biopsy, but also a targeted biopsy on these 2 lesions. The advantage of performing a targeted biopsy is that it is not uncommon for small lesions to be located outside of what could be detected on a standard 12-core biopsy template. In the cartoon on the left, you can see that the prostate lesion, which may be cancerous, is actually located in between where the 6 systematic cores are obtained. In this particular example, you can see that the systematic cores would have detected the prostate cancer since the cores would be obtained from where the prostate cancer is located. Going back to the example on the right-hand side, you can see that this lesion right here is located in between cores 6 and 3 and may have been missed on a systematic template biopsy, whereas lesion 14 here does correspond and overlap with one of the systematic cores and therefore may have been detected on a standard prostate biopsy. Again, this next slide is to demonstrate how this is used in the live setting. Again, here is a cartoon representation of the planned 12-core systematic prostate biopsy, along with a targeted biopsy of 3 particular lesions in the prostate, none of which may have necessarily been picked up on a standard prostate biopsy. In addition to providing us this cartoon in order to target the prostate, the outline of the prostate from the MRI images, as well as the location of the potential targets, are overlaid onto the live ultrasound image, allowing us to appropriately place the needle into the lesion. Prostate biopsies are usually performed under local anesthesia, and the entire process takes roughly 20 to 30 minutes. Fasting is not required prior to a prostate biopsy. However, an enema or a bowel movement is in order to empty the rectal vault prior to the biopsy. There are associated risks with the biopsy as it is a procedure. These include bleeding, as well as infection. In order to minimize the risk of bleeding, patients are asked to discontinue any blood thinners or aspirin products if allowed to prior to the biopsy. Following the biopsy, you may notice blood in the urine and the stool, as well as the semen. In order to minimize the risk of infection, oral antibiotics are started 1 day prior to the biopsy. If you are scheduled for a prostate biopsy, a prescription will be provided and you are instructed to start the prostate biopsy antibiotics 1 day prior to the biopsy. In addition, at the time of biopsy, an antibiotic injection will be delivered intramuscularly to further reduce the risk of infection. If there is a temperature or a fever of over 101 to 101.5 following the biopsy, This is not normal, and therefore you should call the office. There are a few misconceptions regarding prostate biopsy. These include the fact that prostate biopsy can result in cancer spreading or seeding, and that prostate biopsy results in erectile dysfunction. Both of these misconceptions are simply not true. Following the biopsy, you will be provided post-biopsy instructions, which will be reviewed with you prior to discharge from the office. You will be instructed to complete the antibiotics which have been prescribed, and you will also be reminded that it is normal to see blood in the urine and the stool in a limited fashion for up to 24 to 48 hours after the biopsy. You will also be reminded, however, that blood may be present in the semen for up to 6 weeks following the prostate biopsy. You do need to call the office, however, if you do experience fevers or chills and a temperature over 101, despite the antibiotics. You will be scheduled for a follow-up visit after the biopsy the following week to ensure that there were no complications from the biopsy and to review the results of the biopsy. I want to thank you for taking the time to listen to this brief overview of prostate biopsy. If you would like to review additional videos regarding prostate cancer diagnosis, or to review the biopsy instructions, please scan the QR code listed here on this slide. In addition, you can access this video as well as others, along with the instructions on the website listed here on this slide as well. Thank you.